barely stand up. Her mom, Keisha, rushed her to the emergency room at City General Hospital, her heart pounding with worry. "Please help my baby," Keisha said to the doctor at the front desk. Her voice was shaking as she watched Zara curl up in the waiting room chair, tears streaming down her face. Dr. Thompson, a kind man with gray hair, examined Zara quickly. His face grew serious as he pressed gently on her stomach. "We need to get her into surgery right away," he told Keisha. "It's her appendix and we can't wait. Everything happened so fast after that." Nurses wheeled Zara into the operating room while Keisha signed papers with trembling hands. The surgery took about an hour, and Dr. Thompson came out with good news. "She's going to be just fine," he said with a smile. "The surgery went perfectly. She'll need to stay for a couple of days to recover, but she should be back to her normal self soon." Keisha felt like she could breathe again. She kissed Zara's forehead as they moved her to the recovery room. "Mommy will be right here when you wake up, sweetheart," she whispered. But visiting hours were ending, and the hospital had strict rules about overnight stays. "You can come back first thing in the morning," the nurse at the desk told Keisha. "She'll be sleeping most of the night anyway from the medicine." Keisha didn't want to leave, but she knew she needed to go home and get some rest. She had to work in the morning, and she wanted to be strong for Zara. "I'll be back as soon as I can," she promised her sleeping daughter before reluctantly heading home. That's when Patricia Williams started her night shift. Patricia had been a nurse for 15 years, and she thought she had seen everything. She was tired, cranky, and not happy about being assigned to the children's ward again. She preferred working with adults who didn't cry and whine all the time. Patricia looked at her patient list for the night. When she saw the name Zara Jackson in room 302, she sighed heavily. She had noticed the family earlier during the shift change, and she already had opinions about them. The way the mother had been fussing over the child, asking so many questions, demanding to know every little detail about the surgery. Some people just make everything more complicated than it needs to be, Patricia muttered to herself as she gathered her supplies for the evening rounds. When she walked into room 302, Zara was just starting to wake up from the anesthesia. The little girl's eyes fluttered open, and she looked around the unfamiliar room with confusion and fear. "Where's my mommy?" Zara asked in a small, scared voice. Her throat was dry from the surgery, and she felt dizzy and confused. "Your mother went home?" Patricia said without looking up from her clipboard. Her voice was cold and matter-of-fact. "You need to be a big girl now and stop looking for someone to baby you." Zara's bottom lip started to tremble. She was only 8 years old and she had just had surgery. Everything hurt, and she was scared. "When is she coming back?" she whispered. "In the morning, if you're lucky," Patricia replied, still not making eye contact. She roughly adjusted Zara's IV line, causing the little girl to wince in pain. "Now stop asking questions and go back to sleep." But Zara couldn't sleep. Her stomach hurt where they had done the surgery, and she felt sick to her stomach. Worse than that, she felt scared and alone. She had never spent a night away from her mom before. "Excuse me?" Zara said quietly when Patricia came back into the room an hour later. "My tummy really hurts. Can I have some medicine?" Patricia looked at her watch and frowned. "You just had medicine 2 hours ago. You don't need more yet. Stop being dramatic." "But it really hurts," Zara said, tears starting to fall down her cheeks. "Please?" "I said no," Patricia snapped. "And stop that crying right now. You're 8 years old, not a baby. Other children have had the same surgery and they don't carry on like this." Zara tried to stop crying, but the pain and fear made it impossible. She buried her face in her pillow and tried to be quiet, but small sobs escaped anyway. When other nurses walked by the room, they could hear crying, but Patricia always had an explanation ready. "She's just being fussy," she would tell them. "Some kids are just more dramatic than others. She'll settle down once she realizes no one is going to baby her." The night seemed to go on forever for Zara. Every time she asked for something, water, another blanket, help getting to the bathroom, Patricia would respond with irritation and impatience. When Zara said she felt cold, Patricia told her she was fine and that she needed to toughen up. When Zara said she felt sick to her stomach, Patricia said it was normal and she needed to deal with it. Around 3 in the morning, Zara really needed to use the bathroom. She pressed the call button and waited. When Patricia finally came in, she looked annoyed. "What now?" she asked, standing in the doorway with her arms crossed. "I need to go to the bathroom," Zara said quietly. "Well, you have legs, don't you? Figure it out," Patricia said, turning to leave. "But the doctor said I need help walking for the first day," Zara reminded her. "Because of the surgery." Patricia rolled her eyes dramatically. "Fine, but make it quick. I don't have all night to babysit you." She helped Zara out of bed roughly, not being careful about the IV line or the surgical site. When Zara moved slowly because of the pain, Patricia huffed with impatience. "Come on, move faster. I have other patients to take care of," she said, practically dragging the little girl to the bathroom. The whole experience left Zara feeling even more scared and alone. She had never been treated like this by a grown-up before. Her parents, her teachers, even strangers were usually kind to her. She didn't understand why this nurse was being so mean. As the sun started to come up, Zara was exhausted, but couldn't sleep. She kept watching the clock, counting the minutes until visiting. Hours started and her mom would come back. She had so much to tell her, but she also felt confused about whether she should say anything about the nurse. Maybe this was just how hospitals worked. Maybe she really was being a baby like the nurse said. Patricia finished her shift feeling satisfied that she had maintained order and discipline in her section. In her mind, she had done her job properly. She had kept the child quiet, given her medicine on schedule, and not allowed any nonsense or attention-seeking behavior. She had no idea that her treatment of Zara was about to set off a chain of events that would change everything. Keisha arrived at the hospital bright and early the next morning, carrying a small bag with Zara's favorite stuffed animal and some books. She couldn't wait to see her daughter and make sure she was feeling better after the surgery. But when she walked into room 302, her heart sank. Zara looked tired and pale, with dark circles under her eyes. The little girl's face lit up when she saw her mom, but Keisha could tell something was wrong. "Hi, baby girl," Keisha said softly, giving Zara a gentle hug. "How are you feeling?" "I missed you so much, Mommy," Zara whispered, holding on tight. "My tummy still hurts, and I didn't sleep very well." Keisha frowned. "Did the nurse give you medicine for the pain?" Zara hesitated. She wasn't sure how to explain what had happened during the night. "She said I don't need medicine yet," she finally said. Before Keisha could ask more questions, Patricia walked into the room. It was the start of her second shift taking care of Zara, and she was already annoyed about having to deal with the family again. "Good morning," Keisha said politely. "How did she do overnight? Did she sleep okay?" "She was fine," Patricia said shortly, not making eye contact. "Slept like a baby once she stopped all the fussing." Something about the nurse's tone bothered Keisha, but she didn't want to cause problems. Maybe she was just imagining things. "When is she supposed to get her next pain medicine?" she asked. "When she needs it," Patricia replied. "Which isn't now. She's not even asking for it." Keisha looked at Zara, who had gone quiet and wouldn't meet her eyes. This wasn't like her daughter at all. Zara was usually chatty and would definitely speak up if she was in pain. After Patricia left the room, Keisha sat down next to Zara's bed. "Honey, tell me the truth. Are you hurting?" Zara nodded slowly. "But the nurse said I'm being dramatic and I need to be a big girl." Keisha felt anger rising in her chest, but she kept her voice calm. "Sweetheart, you just had surgery yesterday. It's okay to hurt, and it's okay to ask for medicine when you need it. You're not being dramatic." But when Keisha went to find Patricia to request pain medication for Zara, the nurse was dismissive. "She's fine," Patricia insisted. "The surgery was routine, and kids her age bounce back quickly. If we give her medicine every time she complains, she'll never learn to handle discomfort." "She's 8 years old and just had major surgery," Keisha said, trying to keep her voice level. The doctor said she should have pain medicine every 4 hours as needed. I'm the nurse taking care of her, and I know what she needs, Patricia replied coldly. I've been doing this for 15 years. I think I know more about post-surgical care than you do. Keisha felt frustrated and confused. She didn't want to argue with the medical staff, but her mother's instincts were telling her something was wrong. She stayed with Zara for as long as visiting hours allowed, but she had to leave for work eventually. I'll be back this evening, she promised Zara. If you need anything at all, you ask the nurse, okay? 8-year-old Zara clutched her stomach as another wave of pain hit her. She had been feeling sick all morning, but now the pain was so bad she could. After Keisha left, Patricia's treatment of Zara got even worse. She seemed to take the mother's questions as a personal challenge to her authority, and she decided to make sure Zara learned not to complain. When lunchtime came, Patricia brought Zara a tray of food, but she didn't help the little girl sit up properly to eat. Zara struggled to reach the food while lying mostly flat, and some of it spilled on her hospital gown. Look at the mess you're making, Patricia said with disgust. Can't you eat without getting food everywhere? I'm sorry, Zara said, trying to clean up the spill. It's hard to sit up because my tummy hurts. That's just an excuse, Patricia replied. You need to try harder. When Zara asked for help getting to the bathroom later that afternoon, Patricia made her wait for almost 30 minutes before responding to the call button. By then, Zara was desperate and barely made it to the bathroom in time. You need to plan better, Patricia scolded. I can't drop everything just because you suddenly decide you need to go. But the worst part was how Patricia spoke to Zara when other staff members weren't around. She would make comments about how some children were raised to expect everyone to wait on them hand and foot. She told Zara that other kids were braver and didn't need their mommies to come rescue them all the time. These words hurt Zara more than the physical pain from her surgery. She started to believe that maybe she really was being a baby. Maybe other kids wouldn't ask for medicine or help or comfort after surgery. Maybe she was just weak and spoiled, like the nurse said. By the second evening, when Keisha came to visit, Zara had almost stopped asking for things she needed. When her mom asked if she was thirsty, Zara just shrugged. When Keisha noticed that Zara's water cup was empty and had been for hours, she felt another wave of concern. Why didn't you ask the nurse for more water? Keisha asked. I didn't want to bother her, Zara said quietly. She's really busy. This wasn't like her daughter at all. Zara had always been good at speaking up for herself and asking for what she needed. Now she seemed scared and withdrawn. When Keisha tried to talk to Patricia about it, the nurse had explanations for everything. Zara was adjusting well to being independent. She was learning not to rely on others for every little thing. The nurse made it sound like this was all part of Zara's recovery and growth, but other nurses were starting to notice that something seemed off. Rebecca, a young nurse who had been working at the hospital for 2 years, walked by Zara's room several times and noticed that the little girl always seemed sad and quiet. Most kids after routine surgery were uncomfortable but still had some personality and energy. Zara seemed almost depressed. How's the little girl in 302 doing? Rebecca asked Patricia during their shift overlap. Fine, Patricia replied quickly. She's just one of those kids who needs to learn some independence, too used to being babied at home. Rebecca nodded, but something about Patricia's tone bothered her. She made a mental note to keep an eye on the situation. Meanwhile, Zara's physical recovery wasn't going as smoothly as it should have been. The surgical site was more tender than expected, and she was running a low-grade fever. But when she mentioned feeling hot and achy to Patricia, the nurse brushed off her concerns. It's normal to feel uncomfortable after surgery, Patricia said. You're not running a real fever. Some people just complain more than others. Patricia didn't check Zara's temperature carefully, and she didn't report the little girl's concerns to the doctor. In her mind, Zara was just being fussy and looking for attention, like she had been since the first night. As the second night fell, Zara lay in her hospital bed feeling more alone and scared than she ever had in her life. The pain in her stomach was getting worse, not better, but she had learned not to ask for help. The nurse had made it clear that asking for things was wrong and annoying. Zara closed her eyes and tried to sleep, but the pain and the sadness made it impossible. She missed her mom terribly, and she couldn't understand why the nurse was so mean to her. She had always been taught that nurses were helpers, like doctors and teachers. But this nurse made her feel bad about herself and scared to ask for basic things like water or medicine. What Zara didn't know was that her condition was starting to get more serious. The infection that was beginning to develop at her surgical site needed immediate attention. The fever that Patricia had dismissed was actually her body's way of fighting off bacteria that had gotten into the wound. But Patricia was so focused on her belief that Zara was just being difficult that she missed all the signs that something was genuinely wrong. She was so convinced that the little girl was spoiled and attention-seeking that she couldn't see past her own prejudices to notice that Zara actually needed medical care. The stage was being set for a medical crisis that could have been prevented if Patricia had just done her job with basic human kindness and professional care. By the third day, Zara was feeling much worse, but she had learned to keep quiet about it. The pain in her stomach had changed from the expected post-surgery discomfort to something sharper and more intense. Her fever was climbing, though Patricia continued to ignore her complaints about feeling hot and sick. "My tummy feels different," Zara whispered to Patricia when she came to check her vital signs that morning. "It hurts more than before and it feels hot." Patricia barely glanced at the surgical site as she took Zara's temperature with an old thermometer that didn't work properly. "You're fine," she said dismissively. "Stop looking for problems that aren't there." But Zara wasn't fine. The surgical incision was becoming red and swollen, and there was a concerning warmth around the area that indicated infection. Her fever was now over 101 degrees, though Patricia's faulty thermometer didn't register it correctly. "I feel really sick," Zara said, her voice weak. "Can you call my mommy?" "Your mother will be here during visiting hours," Patricia snapped. "And there's nothing wrong with you that requires calling anyone. You're just being dramatic again." "What?" Patricia didn't realize was that surgical site infections could be dangerous, especially in children. Zara's body was fighting hard against bacteria that had gotten into the wound, probably due to Patricia's poor attention to hygiene and wound care over the past 2 days. When Dr. Thompson stopped by during his morning rounds, Patricia gave him a brief, misleading update. "She's doing well," she reported. "Normal post-operative course. She complains a lot, but that's just her personality. Some kids are more dramatic than others." Dr. Thompson was busy with several other patients and trusted Patricia's assessment. He didn't examine Zara closely, just asked how she was feeling from the doorway. "I'm okay," Zara said quietly, because she had learned that saying anything else would get her in trouble with the nurse. If Dr. Thompson had looked more carefully, he would have seen the signs of infection immediately. But Patricia's dismissive report and Zara's learned silence prevented him from getting the full picture. As the day went on, Zara's condition continued to worsen. She was having trouble keeping food down, her fever was rising, and the infection was spreading. But Patricia attributed all of these symptoms to attention-seeking behavior. When Zara threw up her lunch, Patricia was angry rather than concerned. "This is ridiculous," she said, roughly cleaning up the mess. "You're making yourself sick on purpose to get attention." "I'm not doing it on purpose," Zara protested weakly. "I really feel sick." "Don't lie to me," Patricia shot back. "I've seen this behavior before. Some children will do anything to make people feel sorry for them." Rebecca, the young nurse who had been concerned about Zara, happened to walk by the room during this exchange. She heard Patricia's harsh tone and saw Zara looking pale and miserable in the bed. "Is everything okay in here?" Rebecca asked, stepping into the room. "Everything's fine," Patricia said quickly. "Just dealing with some behavioral issues." Rebecca looked at Zara more carefully. The little girl's eyes looked glassy, and her cheeks were flushed with fever. "She looks a little warm," Rebecca observed. "Has her temperature been checked recently?" "I checked it this morning," Patricia lied. "It was normal." But Rebecca's nursing instincts were telling her something was wrong. When Patricia left the room, Rebecca smiled gently at Zara. "How are you really feeling, sweetheart?" Zara looked around nervously. afraid of getting in trouble. "I'm not supposed to complain," she whispered. "You're not complaining," Rebecca said softly. "I'm asking, because I want to help you feel better. That's what nurses do." "My tummy really hurts," Zara admitted, "and I feel hot and sick, but Nurse Patricia says I'm being dramatic." Rebecca felt alarm bells going off in her head. She quickly but gently examined Zara's surgical site and was shocked by what she saw. The incision was clearly infected with redness, swelling, and warmth that indicated a serious problem. "Zara, I'm going to get the doctor right away," Rebecca said, trying to keep her voice calm so she wouldn't scare the little girl. "Am I in trouble?" Zara asked fearfully. "No, honey, you're not in trouble at all," Rebecca assured her. "You did exactly right by telling me how you feel." Rebecca immediately paged Dr. Thompson and reported what she had found. When the doctor arrived and saw Zara's condition, his face grew grave. "How long has she been like this?" he asked Rebecca. "I'm not sure," Rebecca replied carefully. "I just noticed it now when I was walking by." Dr. Thompson examined Zara thoroughly and ordered immediate blood tests and IV antibiotics. "This is a significant surgical site infection," he told Rebecca quietly. "She needs treatment right away." When the test results came back, they confirmed everyone's worst fears. Zara's white blood cell count was dangerously high, indicating that her body was fighting a serious infection. The bacteria had spread beyond the surgical site and was threatening to cause sepsis, a life-threatening condition. "We need to contact her parents immediately," Dr. Thompson ordered, "and I want to know how this infection was missed for so long." When Keisha got the call at work, her world stopped. "What do you mean there's an infection?" she asked, her voice shaking. "How did this happen?" "We're treating it aggressively," Dr. Thompson explained. "But I need you to come in right away." Keisha dropped everything and raced to the hospital. When she saw Zara lying in bed with IV antibiotics and looking so sick and weak, she felt like her heart was breaking. "Why didn't anyone tell me she was getting worse?" Keisha demanded. "I was here yesterday evening and no one said anything about an infection." Dr. Thompson looked uncomfortable. "I'm going to investigate exactly what happened," he promised. "Right now my focus is on getting Zara better." But Keisha wasn't satisfied with that answer. She had a sick feeling that something had gone very wrong with her daughter's care, and she was determined to find out what. "Mommy," Zara whispered when they were alone. "I tried to tell Nurse Patricia that I felt sick, but she said I was being dramatic, and I needed to stop complaining." Keisha felt anger like she had never experienced before. "What do you mean, sweetheart?" Through tears, Zara told her mother about the past 3 days, how the nurse had been mean to her, how she had been denied pain medicine and basic care, how she had been made to feel bad for asking for help when she was sick. "She said other kids don't act like babies after surgery," Zara whispered. "She said I need to toughen up and stop looking for people to baby me." Keisha was horrified. Her 8-year-old daughter had been suffering not just from a serious medical condition, but from emotional abuse from the very person who was supposed to be caring for her. "You did nothing wrong," Keisha told Zara firmly. "Nothing at all. You were sick and you needed help, and that's exactly what you should have asked for." As she sat by her daughter's bedside, watching the IV antibiotics drip into her small arm, Keisha made a decision. She was going to make sure that Patricia faced consequences for what she had done, and she was going to make sure this never happened to another child. What Keisha didn't know yet was that help was about to arrive in a way that Patricia would never expect. Zara's father was finally coming home from his business trip, and when he learned what had happened to his daughter, things were about to change very quickly. The infection that Patricia had allowed to develop through her negligence was serious, but it was about to become the least of her problems, because Dr. David Johnson was not just any concerned father. He was someone with the knowledge, connections, and authority to make sure that justice was served. Dr. David Johnson was in the middle of a medical conference in Chicago when his phone started buzzing with urgent calls from his wife. He had been presenting research on surgical procedures to a room full of doctors when he saw Keisha's name pop up on his screen for the 3rd time in 10 minutes. Stepping out of the conference room, he answered the call. "Keisha, what's wrong?" David, you need to come home right now, Keisha said, her voice tight with worry and anger. Zara is in the hospital with a serious infection, and I think she's been mistreated by her nurse. David felt his blood run cold. What do you mean, mistreated? What kind of infection? As Keisha explained everything that had happened over the past 3 days, David's anger grew with each detail. He was a surgeon himself, with over 12 years of experience at Metropolitan Medical Center, one of the city's most prestigious hospitals. He also served on the state medical board and was well known in the medical community for his work on patient safety and hospital standards. I'm catching the next flight home, he told Keisha. Don't let that nurse near Zara until I get there. David canceled his remaining conference presentations and booked the earliest flight back to the city. During the 3-hour flight, he made several phone calls to colleagues and started researching the legal and professional implications of what Keisha had described. By the time he arrived at City General Hospital, it was early evening. David walked through the halls with the confident stride of someone who knew hospitals inside and out. He understood the protocols, the hierarchy, and most importantly, he knew exactly what questions to ask. When he reached Zara's room, his heart broke seeing his little girl looking so pale and weak with an IV line running antibiotics into her arm, but his medical training kicked in, and he immediately began assessing her condition with a doctor's eye. Hi, Daddy, Zara said weakly, managing a small smile when she saw him. Hi, baby girl, David said softly, kissing her forehead. Daddy's here now, and we're going to make sure you get better. He spent several minutes talking with Zara and Keisha, getting the full story of what had happened. Every detail made him more angry and more determined to take action. When Patricia arrived for her evening shift, she had no idea what was waiting for her. She walked into Zara's room expecting to find the same family she had been dismissing for the past 3 days. Instead, she found a tall, well-dressed black man in an expensive suit standing next to Zara's bed, reviewing her medical chart with the expertise of someone who clearly understood what he was reading. Excuse me, Patricia said with her usual dismissive tone. Visiting hours are almost over, and I need to check on my patient. David looked up from the chart and fixed Patricia with a steady gaze. I'm Dr. Johnson, he said calmly, Zara's father, and I'd like to discuss her care with you. Patricia's confidence faltered slightly at the word doctor, but she quickly recovered. She had dealt with family members who worked in medical fields before, and she wasn't impressed. Well, doctor, she said with a slight emphasis on the title, that made it sound dismissive. Your daughter is doing fine. Children sometimes get infections after surgery. It's not uncommon. Not uncommon, David repeated slowly. Are you telling me that surgical site infections that progress to near sepsis are routine complications that I shouldn't be concerned about? Patricia shifted uncomfortably. The way he was speaking suggested he knew more about medicine than the average family member. Every case is different, she said defensively. Some children are just more prone to complications. I see, David said, making notes in a small notebook he had pulled from his jacket pocket. And in your professional opinion, what caused this particular infection? Sometimes these things just happen, Patricia replied, but her voice was less confident now. It's not anyone's fault. David nodded thoughtfully. I'd like to review her nursing notes from the past 3 days if you don't mind. I'm particularly interested in the wound care protocols that were followed and the frequency of temperature checks. Patricia felt panic starting to rise in her chest. I don't think family members are allowed to see nursing notes, she said quickly. Actually, David said with a slight smile that didn't reach his eyes, as a physician and a member of the state medical board, I'm well within my rights to request a full review of my daughter's care. But we can start with the nursing notes. The blood drained from Patricia's face. State medical board? She repeated weakly. Yes, David said casually, as if he was discussing the weather. I serve on the committee that reviews cases of medical negligence and nursing misconduct. I'm also the head of surgery at Metropolitan Medical Center, and I consult on patient safety protocols for several hospitals in the state. Patricia felt like the floor was falling out from under her. This wasn't just some concerned father. This was someone with real power in the medical community, someone who could end her career with a phone call. "Dr. Johnson," she began, her tone completely different now. "I think there might be some misunderstanding about your daughter's care. Let me get her chart and we can go over everything together." "That's an excellent idea," David said, his voice remaining calm and professional. "While you're doing that, I'd also like to speak with the charge nurse and review the hospital's policies on post-operative care and pain management for pediatric patients." Patricia hurried out of the room, her mind racing. She tried to remember exactly what she had documented in Zara's chart over the past 3 days. Had she recorded the temperature check she claimed to have done? Had she noted the pain medication schedule correctly? More importantly, had any of the other nurses witnessed her treatment of Zara? She thought about Rebecca, who had been asking questions about Zara's condition. What had Rebecca seen? What might she report? When Patricia returned with the chart, David reviewed it methodically. His expression grew more serious with each page. "I noticed that you documented normal temperatures for the past 2 days," he said, looking up at Patricia. "Yet my daughter was clearly running a fever. I also see that pain medication was noted as refused by patient on several occasions. Is that accurate?" Patricia's mouth went dry. "Sometimes children don't want to take medicine," she said weakly. "My daughter is 8 years old and just had major surgery," David replied. "Are you telling me that an 8-year-old child refused pain medication after an appendectomy? That seems highly unusual." Before Patricia could answer, Rebecca appeared in the doorway. "Excuse me," she said to David. "I'm Rebecca, one of the nurses on this floor. I wanted to check on Zara and see how she's doing." "Please come in," David said warmly. "I'm Dr. Johnson, Zara's father. I understand you were the one who first noticed that her surgical site looked infected?" Rebecca glanced nervously at Patricia, then back at David. "Yes, I was concerned about her condition and called Dr. Thompson right away." "I'm very grateful that you were paying attention," David said sincerely. "I'd like to ask you a few questions about what you observed, if you don't mind," Patricia tried to interrupt. "Dr. Johnson, I think we should discuss this privately rather than involving other staff members." "Actually," David said, cutting her off, "I think it's important to get a complete picture of my daughter's care from everyone who was involved. Rebecca, you said you were concerned about Zara's condition. How long had you been noticing problems?" Rebecca looked uncomfortable, but she answered honestly. "I had walked by her room several times over the past couple of days, and she always seemed very quiet and sad. That's not typical for children after routine surgery. They're usually uncomfortable but still have some energy and personality. And when you examined her today, what did you find?" "Her surgical site was clearly infected," Rebecca said. "Red, swollen, warm to the touch. And she was running a fever. She told me she had been feeling sick but was afraid to complain because—" Rebecca trailed off, glancing at Patricia again. "Because what?" David prompted gently. "She said Nurse Patricia told her she was being dramatic and needed to stop complaining," Rebecca finished quietly. The silence in the room was deafening. David made more notes in his notebook while Patricia stared at the floor, realizing that her career was probably over. "I think I have enough information for now," David said finally. "Patricia, I'll be filing a formal complaint with the hospital administration first thing tomorrow morning. I'll also be reporting this incident to the State Nursing Board and requesting a full investigation." Patricia opened her mouth to protest, but no words came out. She had spent 3 days treating a sick child with cruelty and neglect, and now she was facing the consequences. "In the meantime," David continued, "I want my daughter transferred to the care of a different nurse immediately, and I want a meeting with the hospital administrator, the chief of surgery, and the head of nursing first thing tomorrow morning." As Patricia left the room, her hands shaking, she realized that her 15-year nursing career was about to come to an end. She had thought she was dealing with just another demanding family, but she had made the mistake of her life. David sat down next to Zara's bed and took his daughter's hand. "Everything's going to be okay now, sweetheart," he told her. "Daddy's going to make sure you get the best care, and we're going to make sure this never happens to another little girl." Zara looked up at her father with relief and trust. Are you going to make sure the mean nurse can't be mean to other kids? She asked. Yes, baby girl, David said firmly. I'm going to make sure of that. The next morning, David arrived at City General Hospital at 7 o'clock sharp, carrying a briefcase full of documentation and a determination to see justice done. He had spent the night making phone calls to colleagues, reviewing medical protocols, and preparing for what he knew would be a difficult but necessary confrontation. His first stop was the office of Dr. Helen Rodriguez, the hospital administrator. Dr. Rodriguez knew David by reputation and was surprised to see him in her office so early in the morning. David, what brings you here? She asked, gesturing for him to sit down. My daughter has been a patient here for the past 4 days, David began, his voice calm but serious. She's been the victim of medical negligence and what I can only describe as abuse by one of your nursing staff. Dr. Rodriguez's expression grew grave as David laid out the complete timeline of Zara's care, supported by medical records, witness statements, and his own observations as a physician. He showed her the discrepancies in Patricia's documentation, the evidence of the untreated infection, and Rebecca's account of what she had witnessed. This is extremely serious, Dr. Rodriguez said when David finished his presentation. If what you're telling me is accurate, we have multiple policy violations and potentially criminal negligence. It's all documented, David replied, sliding a thick folder across her desk. I've prepared a complete report with medical evidence, witness statements, and a timeline of events. I'm also filing complaints with the State Nursing Board and the State Medical Board. Dr. Rodriguez reviewed the documents quickly, her face growing more serious with each page. I'm calling an emergency meeting with our chief of nursing and our legal department, she said, reaching for her phone. This nurse will be suspended immediately pending a full investigation. I appreciate that, David said. But I want to make sure this leads to real changes, not just disciplinary action against one individual. The fact that Patricia's behavior went unnoticed for 3 days suggests systemic problems with oversight and accountability. Within an hour, Patricia was called into a meeting with hospital administration. When she walked into the conference room and saw David sitting at the table with Dr. Rodriguez, the chief of nursing, and the hospital's legal counsel, she knew her worst fears were coming true. Patricia, Dr. Rodriguez began, we're here to discuss serious allegations about the care you provided to patient Zara Johnson over the past 4 days. Patricia tried to defend herself, but the evidence was overwhelming. Her own nursing notes contradicted her claims about Zara's condition. Rebecca's witness statement detailed specific instances of neglect and verbal abuse. Most damning of all, the medical evidence showed that Zara's infection had been allowed to progress to a dangerous level, despite clear warning signs. I was just trying to teach her independence, Patricia said weakly. Some children are more demanding than others, and I thought. You thought what? David interrupted, his voice still calm but with an edge of steel. That an 8-year-old child who just had major surgery was being too demanding when she asked for pain medication? That she was seeking attention when she complained about symptoms of a serious infection? Patricia had no answer. The room fell silent as everyone realized the full scope of what had happened. Effective immediately, you are suspended without pay pending the completion of our investigation, Dr. Rodriguez announced. You are not to return to this hospital or have any contact with patients until this matter is resolved. As Patricia left the hospital that day, she knew her nursing career was over. Within a week, the State Nursing Board had begun their own investigation. Within a month, her license was permanently revoked. But David wasn't finished. He worked with the hospital to implement new protocols for pediatric postoperative care, including mandatory bias training for all nursing staff and stricter oversight of patient care. He also helped establish a patient advocate program that would ensure families had someone to turn to when they had concerns about care. The story didn't end with Patricia's firing. The local news picked up the story, and it became a catalyst for broader discussions about discrimination in healthcare. David used his position and influence to speak at medical conferences about the incident, turning his family's traumatic experience into an opportunity to educate other healthcare professionals. This wasn't just about one bad nurse, David would tell audiences. This was about systemic failures that allowed bias and prejudice to impact patient care. We have to do better, Zara's physical recovery took several weeks, but with proper care and treatment, she made a full recovery. The emotional healing took longer. She had nightmares about being in the hospital and was afraid of medical procedures for months afterward. But her parents made sure she got the counseling and support she needed. They also made sure she understood that Patricia's behavior was wrong and that most healthcare workers were caring, dedicated professionals who would treat her with kindness and respect. "You did nothing wrong," David told his daughter over and over again. "You were sick and you asked for help, and that was exactly what you should have done. The grown-up who was supposed to take care of you made bad choices, but that wasn't your fault." 6 months later, Zara had to go back to the hospital for a routine follow-up appointment. She was nervous about seeing nurses again, but when she met her new healthcare team, she was amazed by the difference. "Hi, Zara," said Nurse Jennifer with a warm smile. "I'm going to be taking care of you today. Is there anything I can do to help you feel more comfortable?" The contrast with Patricia's cold, dismissive treatment was like night and day. These nurses listened to Zara's concerns, answered her questions patiently, and made sure she felt safe and cared for throughout her visit. "See?" Keisha whispered to her daughter. "This is how nurses are supposed to act." Patricia, meanwhile, had to find a new career. With her nursing license revoked and the incident part of the public record, she couldn't work in healthcare anymore. She eventually found work in a completely different field, but the consequences of her actions followed her. She had lost not just her job, but her professional reputation and her ability to ever work as a nurse again. The 3 days of cruel treatment she had inflicted on a sick child had cost her everything she had worked for over 15 years. More importantly, the changes that David helped implement at City General Hospital and other medical facilities meant that Patricia's behavior was much less likely to happen to other children. New training programs taught healthcare workers about unconscious bias and the importance of treating all patients with equal care and respect. The patient advocate program that was established in Zara's honor helped dozens of other families navigate difficult medical situations and ensured that concerns about patient care were taken seriously and addressed quickly. A year later, David received a letter from Rebecca, the nurse who had first noticed Zara's infection and spoken up about Patricia's treatment. She had been promoted to charge nurse and was leading the implementation of the new patient care protocols. "Thank you for standing up for your daughter and for all of us," she wrote. "The changes you helped bring about have made our hospital a better place for everyone." Zara's courage in speaking up about what happened to her, even when she was scared, helped protect other children from going through the same thing. David shared the letter with Zara, who was now 9 years old and back to her normal, happy self. "You helped make sure other kids won't be treated the way you were," he told her. "You should be proud of how brave you were." Zara smiled. "I just told the truth about what happened," she said. "That's what you and Mommy always taught me to do." "That's right," David said, hugging his daughter. "And sometimes telling the truth is the bravest thing you can do." The incident had been traumatic for the whole family, but they had turned it into something positive. Patricia had faced the consequences of her actions. The hospital had improved its patient care protocols, and other families would be protected from similar experiences. Justice had been served not through revenge or cruelty, but through accountability, education, and systematic change. Patricia's attempt to harm a vulnerable child had backfired completely, leading to her own downfall and improvements that would protect countless other patients. In the end, the nurse who had thought she could mistreat a child without consequences had learned that actions always have consequences. And the father, who had seemed like just another worried parent, had turned out to be someone with the knowledge, connections, and determination to make sure that justice was done and that real change happened. Zara's story became a powerful reminder that standing up for what's right, even when it's difficult, can make a difference not just for yourself but for everyone who comes after you.